Liposculpture, Liposuction, tummy tuck, breast augmentation, nose job.
Which one's for you? Dr. William, with 36 years of experience, breaks it down, and we ask him everything you want to know.
Hi, my name is William Murillo. I'm plastic surgeon here in Cali, Colombia. I did my studies of medicine in Brazil, also my training in plastic surgery in Brazil. Since then, I have been working in many places. In the United States, I was professor at Louisiana State University. Also, I did some work in French Guiana and in Mexico. I have published many articles in scientific magazines for plastic surgery. I've been in practice for almost 36 years. You asked me about Louisiana State University. I was professor for about 10 years. Most of international patients, they come here for liposculpture. Yeah, so liposuction, also tummy tuck. They come also for breast augmentation, nose job also. This is the most important procedure they look for. When you talk about liposuction, the name says suction, and lipo means fat and suction fat. But when you talk about liposculpture, it means that you harvest fat from one side and put it in another side. For instance, for buttock augmentation. Yeah. By the way, the first paper talking about how does the fat behave after being injected in the buttock, the first study looking with images, how does it work, was mine. Okay. That was the first in the world. When we talk about abdominoplasty, it means that we get to remove the skin and fat excess of the abdomen. It's that people call tummy tuck. And nowadays, we have been reducing the necessity of tummy tuck because we use a new device made in Colombia called lipolaser, and with this we can remove the fat and make the skin to shrink, to retract, and in this way, in some cases, we can avoid the tummy tuck. When we introduce the lipolaser, it means that with the one we use have three advantages. First, a green light reduces the risk of bleeding. The red one melt the fat and make the liposuction easier. And the infrared, it shrinks the skin. This shrinking, it doesn't happen right away you perform the procedure. It is something that is gonna happen over time. Even 1 year after the procedure, the skin keep shrinking. A surgical procedure. When they go back to their countries, they don't need to do another procedure. It's the same. They need to take care of themselves wearing a garment, yeah, and some foam to keep the skin tight against the abdomen, against the body, and it is the only thing they need. For breast augmentation, normally we use implants. Yeah, silicone implants to improve the size of the breast. But we can improve also the size with fat, lipo injection on the breast. Yeah, the implant is an external device that doesn't change their size. But with fat, your body can digest, can absorb some of this fat, and the size initially get in the procedure can be reduced because of the absorption of the fat by the body. Sometimes people come here because they are not happy with their facial appearance, so they look for a facelift. What it means? They want a more young appearance that we call facelift. Rhinoplasty is a very popular procedure. We do it through inside the nose. Sometimes it is necessary to open here to lift the nose and perform some changes, but this is a nice procedure because can give you a better appearance. Sometimes people come here looking for procedure for the arms because they have a skin sagging here, yeah? And the traditional procedure was to make a cut from here to here. It's sometimes coming here to the chest. But nowadays with the lipo laser, we can avoid this. It's amazing how does it shrinks, how the skin retracts. Also, we need to use some foam and a garment to keep the skin tight against the arm, yeah. But we can reduce in about 85-90% of the sagging with the lipo laser without having the big cut we used to have in the past. With the lipo laser, when we perform this in about 15 days, we see already an improvement of the aspect. And after 3 months, we can see a real aspect of the arm when the skin is no more sagging. Of course, I request the patient to wear the garment for at least 3 months to get those results, to allow the skin to shrink properly. For buttock augmentation, we can perform 2 kinds of procedures. We can do buttock implants or we can do it with fat. Those are 2 ways to do it. I prefer fat. And why fat? Because it's a natural tissue, it's from yourself, from the person, and gives more natural results. Afterwards, we don't have a fear to get injections on the buttock, because with the implants we have this concern that one injection can damage the implant, but with fat we don't have this fear.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.